Hello. On 3D software automates all workflows based on the landmarks placed on the 3D volume. This is why accurate landmark picking is essential. In this video, we will manually refine the automatically pre-located landmarks while reviewing the anatomically correct placement for each one. Click Preliminary Landmark Picking to automatically place the selected sets of landmarks. For standard diagnostic cases, you can run the process with only the default selected groups. If you're planning to use the orthodontic module, make sure to also select Dentition II before executing. We will go over Dentition II at the end of this video. Click Execute to generate landmarks automatically. The landmark placement is now complete. Although the automated placement generally performs well, some variation may occur depending on the X-ray device. Click Manual Landmark Picking to fine-tune any points as needed. At the center is the main view, where the name of the active landmark appears at the top. This is linked to the landmark list on the left. This main view automatically repositions the 3D volume or switches to a relevant section view to help you place the selected landmark more easily. The definition of each landmark is shown at the bottom of the screen. On the right side, you will find the MPR view, which displays the landmark position on the three planes. At the top is the axial view, in the middle, the sagittal view, and at the bottom, the coronal view. These views help you see the landmark from different planes, making it easier to place the point precisely. You can choose which view appears in the main screen using the main view panel on the left. On the far left, the Landmark Picking panel displays all landmark groups and the landmarks within each group. By default, Select All is enabled. You can uncheck it and select only the groups you want to work with. Let's begin by refining the landmarks in the Cranial Base group. This group contains a total of 11 landmarks, and those essential for reorientation can only be modified within the Reorientation menu. Click Reorientation to begin adjusting these specific landmarks. The sky blue dot indicates the currently active landmark. Click the correct anatomical location to reposition it. If you adjust the point directly on the 3D volume, it moves in full 3D space. If you adjust it on the MPR view, the point moves only within the currently displayed plane. While your cursor is positioned over any slice, scroll the mouse wheel to navigate through parallel slices. To move to the next landmark, you can select it directly from the list, or click the arrow icon in the main view. You can also press the spacebar to quickly jump to the next landmark. To go back to the previous landmark, press Shift and Space together. Let's now go through each landmark one by one. Nation is located at the midpoint of the frontonasal suture, forming the apex of an inverted V shape in the frontal plane. This landmark serves as the origin of the 3D coordinate system 0, 0, 0. Next are the right and left orbitali points. These points lie along the lowest portion of the inner orbital rim. Since this lower margin spans a relatively long distance, divide it into 3 equal sections and place the point in the outer 1/3. The right and left porion are located at the uppermost point of the external auditory canal, and the point must be placed on the bony margin. In the sagittal view, identify the circular outline of the ear canal and click its superior-most bony point. To verify that reorientation has been performed correctly, switch the volume mode to transparent bone mode and check whether the left and right orbital rims are aligned. If they are not aligned, adjust the left orbitali accordingly. For precise fine adjustments, we recommend using the MPR view. Once reorientation is complete, be sure to click Done to apply and save the changes. After you have completed the reorientation, go ahead and click Manual Landmark Picking again. Just note that the 5 landmarks you adjusted in the reorientation step are now locked, so even if you click them, you will not be able to edit them here. Next is the sella. Place the point at the center of the sella turcica, the bony structure that houses the pituitary gland. To make placement easier, the software automatically brings up the appropriate section view. Refer to both the sagittal and axial views in the MPR panel for the best visibility. The frontozygomatic points on the right and left are located at the suture, where the frontal bone meets the zygomatic bone. Look for the bony intersection between the forehead and cheekbone. The orbitali and porian landmarks discussed earlier can only be edited in the reorientation step, so there is no need to adjust them here. Next are the temporal fossa points. These are placed at the most superior point along the inferior border of the zygomatic arch, corresponding to the outer boundary of the temporomandibular joint fossa. Use both the axial and coronal views to identify the TMJ region accurately. Lastly, we'll place the Bayesian. This landmark is located at the midpoint of the anterior margin of the foramen magnum, which is the large opening through which the spinal cord passes. A sagittal section view is displayed to assist your placement. Click to place the point in the main view, and fine-tune its position in the MPR panel if needed. Next, let's move on to the TMJ group. Although this group includes many landmarks, the process of placing the points is quite simple. If you refer to research articles on the temporomandibular joint, you will gain a better understanding of the significance of each point in TMJ diagnosis and how their locations relate to joint function. We will begin by placing points on the lateral and medial poles of the right condyle. Use both the coronal and axial views to guide you as you place these points. The lateral pole point should be placed at the outermost edge of the condyle, and the medial pole point at the innermost edge. A helpful reference for locating the medial pole can be found in diagrams from Dawson's textbook, which clearly illustrate the correct positioning. Once the lateral and medial points are marked, the software automatically generates CDC, the midpoint between them. Based on these 3 points, it establishes the condylar coronal plane, which contains the CDL and CDM poles, and the condylar sagittal plane, which is perpendicular to the coronal plane and passes through CDC. All remaining landmarks in the TMJ group will be placed on one of these 2 planes. This ensures consistency in evaluating the joint space of the TMJ. When the condylar coronal plane appears in the main view, start placing points to measure the coronal joint space. For the glenoid fossa and the condyle, mark the points in the following sequence: lateral, superior, and medial. Be sure to place the points so that the measured distance between GF and CD reflects the perpendicular joint space. Repeat the same process on the opposite side. Keep in mind that the lateral and medial poles on both sides can be adjusted in the MPR panel, but the other TMJ landmarks can only be edited from the main view. In the MPR panel, you will see that the points align along the condylar coronal plane. Starting from the RGFA point, the main view will automatically switch to display the condylar sagittal plane. Here, you will continue placing points on the glenoid fossa and condyle, this time in the order of anterior, superior, and posterior. In the MPR panel, you will notice that the points are now arranged along the condylar sagittal plane. Now let us move on to placing the maxillary landmarks. We'll begin with the key ridge point. This point is used to assess the left-right symmetry of the maxilla and is best visualized in the transparent bone mode, especially in the sagittal view. Place the point at the lowest part of the key ridge, right on the surface of the maxillary bone. Next is the ANS, the most forward-projecting part of the premaxillary bone. Since the bone is thin in this region, it may not be clearly visible in the 3D volume, so it's better to place this point in the MPR view. In the coronal view, scroll through the slices using the mouse wheel and find the point where the white bony structure disappears last. Then, check the axial and sagittal views to ensure the point properly aligns with the contour of the nasal spine. For the PNS, locate the rearmost projection of the palatine bone, which sits just behind the maxilla. Place the point in the sagittal section where the volume is cut through the center. Then switch to the coronal view and scroll through to confirm that it is positioned at the tip of the bony structure. The A point is located at the most recessed part of the anterior curvature, between the ANS and the maxillary alveolar ridge. In the coronal view, scroll through the slices to find the one where the curve dips in the deepest. This point is one of the most important in 3D diagnosis, as it represents the anterior-posterior position of the maxilla. Anterior zygoma refers to the anterior portion of the zygomatic bone. This point is placed on the outer surface of the zygoma, at the deepest concavity along the anterior part of the zygomatic arch. When viewed in the axial plane, look for the turning point in the bone contour and place the point there. Finally, the zygion is the most laterally projecting point of the face when viewed from the front. Place this point at the most prominent lateral part of the zygomatic arch. Now let us move on to adjusting the mandibular landmarks. We will start with the B point. In the sagittal plane, this point lies at the deepest part of the mandibular contour between two key structures. The infradental, which is the highest point of the alveolar crest beneath the lower incisors, and the pogonion, the most protruded point of the mandible. In the coronal view, scroll through the slices to locate the point where the contour dips in the deepest. The pogonion is the most prominent point of the mandibular symphysis and is one of the most important landmarks in 3D diagnosis, as it represents the anterior-posterior position of the mandible. Because it lies on the symphysis, you can identify it in the axial view by looking for the centrally located area of higher bone density, which stands out from the surrounding marrow bone. Next, we will place the gnathion, but before that, we need to mark both the pogonion and the menton first. The menton is the lowest point on the bony outline of the mandibular symphysis. In the axial view, it corresponds to the center of the lower border of the mandible. You may also refer to the mental spine, where the tongue muscles attach, as a reference. Once both the pogonion and menton have been placed, adjust the gnathion so that it lies exactly midway between them. Next, let us mark the CP point, which is the tip of the coronoid process. In the axial view, scroll through the slices to locate the peak of the process. Because the coronoid process angles slightly forward, place the point a little toward the anterior. You can rotate the 3D volume afterward to make sure the point has been placed correctly. For the sigmoid notch, place the point at the deepest point between the condyle and the coronoid process. You can clearly identify this location by scrolling through the axial view to find where the notch dips in the most. The anterior ramal point is the deepest recessed point along the anterior border of the ascending ramus. In the coronal view, scroll through the slices and find the area where the contour curves inward most prominently. The posterior gonion is located at the most prominent point of the lower half of the ramus, where the tangent along the posterior border of the ramus meets the mandibular body. Next is the gonion, an important reference point for assessing mandibular left-right symmetry. This point lies where the posterior border of the ramus transitions into the inferior border of the mandible. To locate it, place the point midway between the posterior gonion and the inferior gonion. The inferior gonion is the lowest point on the posterior part of the mandibular body, where the tangent along the inferior border of the mandible meets the ramus. The lingula is a small bony projection located on the anterosuperior edge of the mandibular foramen, which is the opening through which the inferior alveolar nerve and blood vessels enter the mandible. The main view automatically switches to show the medial surface of the ramus, making it easier to place this point. For the mental foramen, place the point at the most anterior edge of the foramen. This foramen is typically located just below the area of the second premolar. The base of epiglottis is the deepest point between the epiglottis and the base of the tongue, marking the lowest part of the upper airway. Depending on the anatomy of the epiglottis, place the point on whichever side appears deeper. Before we move on to the dentition landmarks, let's save the progress so far. Click Done to confirm the changes made so far, and then click Save at the top of the screen to save your work as an ONS file. Once the file is saved, return to Manual Landmark Picking to continue placing points for the dentition group. The interface will resume from exactly where you left off. Before we begin working on the dentition points, let me introduce 3 useful features that help improve efficiency when handling a large number of tooth landmarks. First, because many teeth share similar shapes, it's easy to get confused about tooth numbering. To help with this, you can enable the dental axis in the Display Option panel. This displays the long axis of each tooth, connecting the crown and root, allowing you to visually confirm that you are placing the point on the correct tooth. In this case as well, you can immediately see that the root point for tooth number 21 was not correctly placed by checking its dental axis. Second, there is the plane indicator, which displays 3 planes intersecting at the currently selected landmark. You can toggle it on and off by clicking Plane Indicator in the section display panel, or simply by pressing the X key on your keyboard. These planes are not fixed around a reference point like nation. They dynamically adjust to the landmark you are currently working on and can be freely rotated. This gives you a clearer view of the tooth in the MPR display, helping you identify its shape more accurately for point placement. When your cursor changes to a hand icon while hovering over a plane, you can click and drag to rotate it. If the cursor turns into a 2-way arrow, you can drag the plane to shift it parallel to its orientation. Any adjustments made to these planes will remain when moving on to the next landmark. Therefore, when marking both the crown point and root point of the same tooth, it is best to keep the adjusted planes as they are. But when switching to a different tooth, we recommend resetting the planes. To reset, click Reset Axis in the section display panel, or press Shift and X on your keyboard. Third, displaying the dentition scan data while placing crown points can be especially helpful for patients with heavy scattering from prosthetic restorations. We will go over how to use of this feature more effectively in the Dentition II section. Now, let us begin reviewing and adjusting the Dentition I group landmarks. The Dentition I group consists of the crown and root points of the central incisors, canines, and first molars, teeth numbers 1, 3, and 6 in all 4 quadrants. These landmarks form the foundation of On3D's automated diagnostic workflow. So if any of these teeth are missing, you will need to substitute an adjacent tooth or manually place the landmark in the estimated location. Let us begin with the upper one midpoint. This point is the midpoint between the crown points of teeth 11 and 21. Because the vertical position can be difficult to determine due to the anatomy of the central incisors, be sure to place this midpoint at the incisal level. We will place the points quadrant by quadrant: upper right, upper left, lower right, and lower left. Let's start with the upper right quadrant. Let's place the points while actively using the plane indicator, toggling it on and off with the shortcut key to better visualize each landmark. For upper 1 crown point, place the point at the midpoint of the incisal edge of the upper right central incisor. When placing the upper 1 root point, keep the same plane adjustments used for the crown point. Since it is the same tooth, the aligned planes will reveal the full tooth shape clearly, making it easier to identify the root tip accurately. Before placing upper 3 crown point, press Shift and X to reset the axis. Then place the crown point. For the root point, consider the tooth axis and place the point on the tip of the root. For upper 6 crown point, mark the mesiobuccal cusp tip, one of the 4 cusps on this tooth. Adjust the red axial plane to align with the occlusal surface and set the green sagittal plane parallel to the buccal surfaces of the adjacent teeth for better orientation. For the root point, select the mesiobuccal root tip among the multiple roots. Now let's move on to the upper left quadrant. Next, we'll place the landmarks for the lower jaw. For the lower 1 midpoint, place the point at the midpoint between the crown points of teeth 31 and 41. Then continue with the lower right quadrant. For lower 6 crown point, the crown point of the lower right first molar, mark the mesiobuccal cusp tip, one of the 5 cusps on this tooth. For the root point, mark the tip of the mesial root, since this molar has 2 roots. Finally, complete the process by placing the corresponding points in the lower left quadrant. Next, we will move on to marking the center of resistance points, which are essential for understanding and describing tooth movement. In On3D software, we follow the definitions outlined in this study comparing maxillary expansion devices. According to this reference, for single-rooted teeth, the CR point is placed at the coronal 1/3 of the root. For multi-rooted teeth, it is placed at the furcation area. We will mark CR points from teeth number 1 through 6. A practical example: the software automatically calculates the distance between the upper and lower first molars' CR points, which is immediately displayed in the diagnostic PowerPoint. This measurement helps visualize the transverse width between upper and lower molars and can be very useful for planning orthodontic treatment. Next, we'll place soft tissue landmarks for soft tissue analysis. If you have the 3D face overlaid, be sure to activate the 3D face option in the Display option panel before placing these points. Any landmark with an S prefix corresponds to the soft tissue point of its underlying skeletal landmark. S. glabella is the most prominent soft tissue point on the forehead. S. nation is the deepest point in the curvature from the forehead to the nose. Scroll through the coronal view to locate the slice where this depression is most pronounced. Endocanthyon is the inner corner of the eye, where the upper and lower eyelids meet medially. Exocanthyon is the outer corner of the eye, where the upper and lower eyelids meet laterally. S. rhinion is the soft tissue point corresponding to the lowest point of the paired nasal bones. This point helps quantify any asymmetry in the central portion of the nose when viewed from the front. To place the S. zygion, first enable Legend in the Display option panel to identify the bony zygion. Using that point as a reference, extend it laterally in parallel with the x-axis to the skin surface and mark the corresponding soft tissue point. Be sure to confirm the placement again in the MPR views. Pronasali is the most prominent point of the nose and is often used to assess nasal tip symmetry. Columella lies between the nostrils and should be placed at the midpoint between pronasali and subnasali. Subnasali is the deepest point where the base of the columella meets the upper lip. Alar points are placed on the most convex areas of the alar base, those rounded outer portions of the nostrils seen from the front. The superior sulcus corresponds to the soft tissue A point and is placed at the deepest part of the curvature between the subnasali and labiali superius. Labiali superius is the midpoint on the vermilion border of the upper lip. Crista filtri points, on both sides, are located where the philtrum ridge meets the vermilion border of the upper lip. The upper lip point is placed at the most anteriorly projecting part of the upper lip in the sagittal view. Stomayon superius is the lowest point on the upper lip's vermilion border. The difference between this point's Z value and that of the lower of the two upper crown points gives the incisor stomayon distance, an essential vertical measurement for determining maxillary position in orthognathic surgery. Chilion, on both sides, mark the outer corners of the mouth where the upper and lower lips meet. The lower lip point is placed at the most anterior projection of the lower lip in the sagittal view. Labiali inferius is the midpoint on the vermilion border of the lower lip. The mentolabial sulcus point is placed at the deepest part of the curvature between the lower lip and the soft tissue chin. S. pogonion is the most anteriorly prominent point on the soft tissue chin in the sagittal view. To place S. gnathion, we first need to mark S. pogonion and S. menton. S. menton is the lowest point on the soft tissue contour beneath the bony menton. In this case, because the chin rest is pressing against the chin, the 3D face data may provide a more accurate reference. Once both points are placed, Mark S. Nathion between them and make any necessary adjustments from the frontal view as well. CNJ, chin, and neck junction is placed at the point where the chin transitions into the neck, as seen in the sagittal view. For the S gonian points on both sides, enable Legend to locate the bony gonian, then extend it laterally parallel to the x-axis, and place the corresponding point on the soft tissue. Confirm the position again in the MPR view. This completes all the default landmark groups. Next, for those using the orthodontic module, we will run the automated process for the Dentition II group and then make manual adjustments. Be sure to check the Keep Existing Landmarks option before running the process. This ensures that all the landmarks you have placed so far remain unchanged. Once that is selected, let's proceed with the automated marking for Dentition II. When working on the Dentition II group, enable both the upper and lower dentition scan data from the Display Option panel. However, this assumes that the scan data has been accurately aligned with the 3D volume. If you have not completed that step yet, please refer to the Scan Data Registration tutorial beforehand. Now, let's adjust the display settings for optimal visibility. Turn off volume, switch the display mode to Visible Landmark, and disable Dental Axis. Using Visible Landmark makes it easier to see exactly where each point is placed on the scan data. From here, we will continue placing the landmarks according to the definitions shown in the lower left corner of the screen. When placing root points, it is helpful to toggle Volume and Dental Axis on and off to obtain a clearer view of the roots. In this case, the patient does not have third molars. So, we will delete both the crown and root points for those teeth by selecting them and pressing the Delete key. However, if you plan to use the third molars for treatment, such as in molar substitution cases, do not delete those points. That completes the landmark adjustments for the Dentition II group. After finishing all edits, be sure to click Done at the bottom left, and then click Save at the top left to save the updated data into your ONS file. If you had previously opened the Panorama or TMJ menus before making these manual adjustments, make sure to revisit those menus and click Apply landmark change. So the updated landmarks are fully applied. That concludes our guide on manually adjusting landmarks in On3D. Thank you for watching.